So what you always hear is that what you don't know won't hurt you. But as we know, that's really not the case. And actually, many times it can hurt you and sometimes kill you. I'm Dr. Angila Jaeggli of Sage Integrative Medicine Clinic, here with my good friend and colleague, Dr. Kalin Suzuki.
Hi.
And today we're here to give you a little bit of information about a really cool panel that we are really loving to see on people from Boston Heart Lab, their cardiovascular risk panel. Can you tell me a little more about that?
Yeah, so Boston Heart is a specialty cardiovascular lab that looks not only at the basic cholesterol labs that your normal lab will run for you, but also they look at biomarkers. Mm-hmm. And these biomarkers, there's different ones, but look specifically at kind of risk for cardiovascular disease and cardiovascular event. And what I mean by event is having a stroke, heart attack, having a clot dislodged, either like a DVT, pulmonary embolism. Yeah. So by looking at these biomarkers, it can tell us kind of the risk of cardiovascular disease. Mm-hmm. And what we meant kind of by what you don't know can kill you is that according to the American Heart Association, 50% of the people who experience sudden heart attacks actually had no idea they had any cardiovascular disease.
Oh my God.
Yeah. And now looking back, doing studies too, we know that 50% of the population who experiences a cardiovascular event had normal or just minimally elevated cholesterol level.
That's incredible.
Yeah.
Yeah. That's amazing. And so really what we're seeing is that we can go a little deeper and actually look at the particles that help us identify inflammation in the arteries.
Yep. Mm-hmm.
And actually risk of plaque rupture, which is pretty incredible.
Yeah.
Do you find that it's common that people have had these done from their primary care?
No, definitely not. I mean, only Boston Heart labs. I think maybe there's another lab, but there's very few specialty cardiovascular labs that look further at the biomarkers. Mm-hmm. And I feel like this is so important because even if you just get your basic lipids and cholesterol levels, and that can look totally normal, but these other biomarkers can be elevated. Yeah. And when we see that, we definitely treat that person completely differently from someone who has a regular cholesterol level and regular biomarkers.
Right. Absolutely. Yeah. And speaking of that, I just saw someone today who had that exact same situation.
Okay.
That everything has looked beautiful for years, but she has a really high family risk. So lots of people in her family have had problems with heart disease.
Yeah.
And so it's a little confounding for her. So when we dug deeper, her markers are very elevated. But she was shocked. Yeah. But her regular cholesterol was completely normal. And in fact, optimal. It actually looked optimal.
Wow.
So if we hadn't have dug further, we wouldn't have found those things.
Exactly. Yeah. So for people who we like to run these labs on, are people who have family history or also personally have a higher risk for elevated risk for cardiovascular disease. So having a poor diet, being overweight, smoking history, and also people who have been diagnosed with elevated cholesterol, but also kind of having a hard time with the treatments, like not responding really well. Either. Yeah.
Right, exactly. And maybe sometimes also a blood sugar issue can be another flag that we might look at.
Yeah, definitely.
For why we would want to look a little deeper into this. So we love running these panels and we love to do it for you. The way that we do that, we actually have a Quest lab in office and we just have you come in, get your history and see which panel best fits for you.
Yeah, and it's just a fasting basic blood draw. And depending also, they're such a great company because they also do like a bonus lifestyle booklet for you.
It's incredible.
Yeah. So they just have you write down a few questions. I'll ask you about like diet preferences, what you follow. And then depending on that and based off of your lab results, they'll come up with a specialty like week plan that's optimal for you. Right. Yeah. Right. So that's
lots of
awesome.
Diet review, diet options. Yeah. It's pretty incredible.
Totally.
Ways that you can reach us, visit sagemedclinic.com and give us a call. Thanks for joining us.
Bye.